Exactly. That is the function of these cells. Touch, right? Remember? So know that, right? They're important for touch. We see them in our epidermis. We have deep ones and we have superficial ones, but just know that tactile cells are important for touch. I don't remember the question on this. So what do you guys remember about the long bone? So what's the top part called? So not all. So yes, I know you took your bone practical, so that is not wrong. But remember, like when we talk more, like if we're to zoom in on the long bone, remember it has like the top part, and it has lots of squishy bone in it, spongy bone, and then it has that middle part, which is more hard, compact bone. What's the name of the two tops of the bone? Like the top and the bottom, and then there's that mid part.
Diaphysis is the middle, right?
Diaphysis. Very good.
Is that the middle?
Yep, that's the middle. So, in medicine Latin land, what does epi mean? Very good. So, epiphysis. Epiphysis. Epiphasias. And then diaphysis, which is diaphasas. Took out a lot of these. So, real quick, if I'm talking about the head of the femur, where does it go?
Into the acetabulum.
Very good. Acetabulum.
Acetabulum. I know ass.
Remember that. The head of the femur fits nicely into the acetabulum. I was going to ask about that. Oh, and one more thing I will mention is the linea aspera, which is on your guys' bone practical, so you should know it, on the anterior or posterior side of the femur.
Posterior.
Posterior side of the femur. Very good, because what muscles are we working?
Hamstrings.
Hamstrings, so it's really for extension, right? So remember that. The linea aspera is on the posterior side of the femur, correct?
Correct.
Good stuff, guys. I am going to ask you one question about the numbering of bones. How many bones do I have in my cervical spine?
5.
7. How many in my thoracic?
12.
12. Very good. And what's the function of my thoracic spine? Really only has one.
Support and protection of the ribs.
Thoracic. What articulates? Respiratory therapist.
Lungs.
Ribs, right? So the main function of my thoracic spine, right, is to hold my ribs. So also helps with, which helps me breathe. Lumbar, how many lumbar vertebrae?
5.
5, very good. Sacrum is just 5 huge vertebrae. You don't have to know that necessarily. And coccyx is just our little tailbone, right? This one trips people up every year and I don't know why. What is the biggest bone in the ankle? Calcaneus. Is that thing massive? Because what's the other word for calcaneus? What is it? Our heel, right? So it's a very, very large bone. So calcaneus. So definitely know that, right? The largest bone in the body is the calcaneus.
Largest bone in the body?
And not in the body, I shouldn't say that. Might be. Crap. Okay. And one thing I will point out on the femur as well, is remember when we talked a little bit about adduction, right, and abduction? What's the difference?
Adduction is coming together, abduction is going apart.
Very good. So if I were going to ask you about an adductor tubercle on my femur, where would that be? Medial or lateral?
Medial.
Medial. Does that make sense? Yeah, so definitely know that for your test too, right? Obviously it's going to be on the medial side of my femur because it's going to bring things together. Versus abduction is what? Brings them apart. So I would know that. So adductor tubercle is going to be on the medial side of what? The femur, right? Going to bring my legs together, not take them apart. Anything to say about that? and you guys should know this too, because we did this on our bone practical. Where is my medial malleolus found? What bone?
Your foot.
Tibia, right? Is part of my tibia, remember? Remember bone practical? Medial malleolus is my tibia. So what does that make my lateral malleolus?
Medial. Oh, sorry.
It
Lateral.
could be both.
Lateral.
I don't know. So what bone is that a part of? Fibula, right? It's not my ankle bones. My ankle bones are like calcaneus, talus, right? Cuboid. All of that's my ankle bones. My medial, and remember these are my big knobs, right? This is my tibia, and this is my fibia. The big knobs are part of my tibia and fibia, correct? So I would also know that. Alright, so I think I took out most of the joint questions. The only ones I really kept are ones that are unique. So what is the name of, I know I don't really go over this a lot, so I'm just going to tell you. So we actually have articulations or joints, essentially between our gums and our teeth. And that type of joint is called a gum phosis. Easy to remember, right? Between our teeth and our gums, we have a joint called gum phosis. So it's not in your test, but why would that be? Why does that make sense why braces work? Would they work if we didn't have a joint?
They break.
I would just break your teeth off, right? I would just break your teeth off if you didn't have a joint, because the joints allow for movement, right? So that's why, too, they make you wear a retainer for so long. Because you're pulling at a joint, you're trying to keep it stayed pulled. So if you don't wear a retainer, it's just going to go back, right? It's a joint. Joints are meant to move. As for the most movable joint and the widest range of motion, kind of the same thing. So what about this one and this one? Ball and socket. Would you agree with that? Do those have the highest range of motion? What about my elbow? Not so much, right? Or my knee. These are just hinge joints, so they don't do a whole heck of a lot. The other term you'll hear for like a lot of movable joints is what's called synovial. So anything that has synovial, as a synovial joint, can do a lot of movement. And what I do want you to know too is the type of joint in the thumb, and I think I've mentioned it before. Saddle, I would know that. The joint in the thumb is the saddle joint, okay?
It's the only saddle joint, right?
Yep, very good. It's the only saddle joint in the human body. And that's what allows me to do opposition, right? Where I can bring my pinky to my thumb. Very good, guys. All right. So, hip joint. I already mentioned what I want you to know. The head of the femur, right, fits into my acetabulum. Looks like ass for a reason. Don't even remember why. We're just gonna skip that. Let's skip that too. I took a lot of these out just now. I don't believe this is in here, is on your guys' test, but tissue versus organ, what's the difference? What is organ made up of? Remember we did that whole hierarchy? Remember it starts as like an atom? A couple atoms come together, make a molecule.
Similar tissues.
Yeah, so an organ is just like-minded tissues, right, coming together. That's an organ. We use the example of a nervous system, remember? You have little neurons, and then they make nervous tissue, and then the tissues come together to make the brain. Haploid and diploid, we already know. 23 chromosomes, and that's our goal of what? Mitosis or meiosis?
Meiosis.
Very good, meiosis. And real quick, sesamoid bones. What is that? Patella. Very good. So it's not necessarily shape. What is a sesamoid bone? You have to remember it, and yes, patella is definitely the best example of it.
Isn't it because it's actually kind of more floating, but
Very good. So it develops in essentially a ligament. So it's like floating. Very good. So patella is the best example. I would know that. Best example of a sesamoid bone is patella. And I took out the skin question, skin cancer question. Any questions about that?